First, I would like to ask you permission to use this video for educational purpose and on internet.
Yes, sir.
Tell me first about your symptoms before the surgery.
I had excruciating pain, and my left leg had electrical shocks and a lot of pain, and would just refuse to work at times.
How long was it going on?
A good year and a half. It just progressively got worse.
What did we figure out? What was the problem?
I had pinched nerves because I had discs that were blown out and squishing everything.
Okay, and we did the surgery. The surgery just was yesterday, correct?
Yesterday morning,
So
about 11.
What exactly did you do?
You fused L4, L5, and S1.
No, first of all, what did I tell you multiple times, especially just before the surgery? What did I tell you?
That it would get worse before it gets better, but that it will get better, and it was remarkable. From yesterday or last night was pretty painful and very uncomfortable, to this morning, and I'm feeling much better. Walking actually is comfortable, makes me feel better.
No, first of all, I told you the first day is rough.
First day's rough, and then it'll get a little better, and then it'll get a little worse again, and then it'll get better. So, but since there's an end in sight, before surgery, there was pain every day with no hope for it getting better. It just progressively got worse. And at least now I'm having pain. It's a different kind of pain.
Yeah, people can say that. It's different.
It really
it's not
is.
the same pain.
Before it was very sharp and electric, and now it's just more like a kind of like a pressure and a fullness.
Let's talk about the leg symptoms.
The leg seems to be fairly normal. It has a little bit of tingling down my left leg and foot, but nothing like before, and it actually works. When I want to walk, it actually walks now.
No, before the surgery, we talked about that the first day is rough because I put a lot of metal in you.
Right.
It is like your body is just figuring out what are they.
Right, doesn't know what to do with it, right?
Yes.
But I feel like it's already getting less.
Already getting better.
Yeah, like it's less pressurized feeling. I
It
guess
is many of my patients that tell me it's like almost like a switch. Sometimes in the night, almost all of a sudden, things start getting better.
Yeah, it really was. From the middle of the night till this morning, it went from just pretty uncomfortable and needing pain medication quite a bit to being comfortable sitting here and not having the pain medicine.
And then we talked about that 4 days after the surgery again, because swelling get worse.
Inflammation,
pain.
right?
Yes, exactly.
Inflammation and swelling, excuse me,
Yeah, so how do you feel this morning?
I feel good.
Did you walk?
I walked. I went up and down stairs.
How did that go?
It went great. It went great. It really did. I felt better walking than I did laying here, and I had no trouble going up and down the stairs.
And that's the point, that people think walking make pain worse, but the actuality
it made it better.
Difficult at first, but it actually makes things better.
The getting up and out of the bed was the trickier part, but then once I was up, the walking actually felt better. I mean, it really, truly felt better.
So, what did you? Is that what you expected before the surgery, based on all the things we gave you, information we gave you?
It is, and it isn't. It is because that's. I mean, I was hoping that it would be that much better, but I guess I maybe didn't expect it to be such a drastic change between feeling so bad to feeling so good in that short amount of time.
Yeah.
Really.
That's why the new patients should hear it from you, not from me, because that's what we say.
Yeah, I'm the one that got cut on. So, but I feel good this morning. And
so far happy with the results?
I'm very pleased. Very pleased with the results. And happy.
Well, the healing is, we are just less than 24 hours after the surgery.
Yeah, and I expect some ups and downs, but there's an end in sight. Like I have a glimpse of that it's going to be good.
Now, because we did the surgery minimally invasively,
right,
you look like somebody who had the surgery traditional way 3 months ago already. Well, this is because after doing thousands of those surgeries and after doing 2,000 of this kind of surgery, I can compare that. It's not perfect. You still have limitation and healing will go on, but you're already one day after the surgery, look like somebody who had the surgery traditional way 2-3 months ago.
Thank you.
Yeah.
Thank you.
Yeah.
No, I feel good. I mean, you would not have guessed that I just had a major back surgery.
Yeah, just looking
not
at-
even 20, not even 24 hours ago.
Yeah. Well, let me tell you another that is actually danger of my surgery. People feel so good so fast.
Right.
They start doing things they're not supposed
I
to.
won't. I
Good.
swear,
I
I'm
know.
gonna follow the rules. I'm not gonna screw it up. I'm gonna follow the rules and do what I'm supposed to, and not do what I'm not supposed to, and
Yeah.
that way I.
Well, I'm sure you will be all right. Okay. Well, thank you for explaining it so
Yeah.
well for future patient. Thank you.
Good.
I
I hope it
appreciate it.
helped.